We are fully aware that there are two types of pertussis vaccine. One is the whole cell vaccine, which is based on killed pertussis organisms, and the other is the acellular pertussis vaccine, which is based on purified pertussis antigens. Now, since 1974, the expanded program of immunization in India, we have been using whole cell vaccine almost exclusively in the government sector. The other countries, especially the developed countries, the Western countries, have switched over to acellular vaccine by 1990s. The topic of discussion today is which of these vaccines should one prefer? Should the pediatricians and general practitioners in India prefer to give in private immunization when they are giving one-to-one immunization? Now let's look at a comparative evaluation of whole cell vaccine and acellular pertussis vaccine in terms of different attributes. This is from the IAP immunization book. Now if you look at the efficacy, what you mean by efficacy is that under experimental conditions, when you take a group of children and you immunize them and you look at the antibody level as well as the disease in the children who are vaccinated and in the control group. That is what is known as the efficacy trial. It is a variable data as far as the whole cell vaccine is concerned, and in acellular vaccine there is robust data. What do you mean by and there has been some concern that the strength of the vaccine, whole cell vaccine, will vary from one slot to the other. There is variation from even in the same manufacturer from one slot to the other. In AP vaccine it is more uniform, but still there is variation based on the methods used in the manufacturing of the vaccine. Now efficacy trials have not been, there is no well-controlled efficacy trials both in India both in acellular vaccine as well as whole cell vaccine. Now your concern regarding efficacy of whole cell vaccine, efficacy is overcome by the fact that there is well-established effectiveness both globally and in India regarding the effectiveness of the whole cell vaccine. By effectiveness we mean the effect of the vaccine on the mortality and morbidity on whooping cough once you have introduced it in the community. In India as well as all over the world, pediatricians as well as community workers have found that year after year after the introduction of the whole cell vaccine, the morbidity and mortality of pertussis vaccine decreases dramatically. Therefore, our concerns about the efficacy of the variable data that whole cell vaccine varies from slot to slot is overcome from the fact at the end of the day it is a very effective vaccine. Now regarding the effectiveness in India, as I already pointed out, that the whole cell vaccine effectiveness is well established. The AP vaccine, there is no much data because it is essentially given in the private sector. Now there is something called priming. Priming, you mean what? When you give the first doses, the immunological systems get primed for protection. Now when you give it with the, as far as priming is concerned, the whole cell vaccine are far superior to the AP vaccine. What it means is that when you give the first primary doses, 6, 10 and 14 weeks, especially the first dose, with the whole cell vaccine, the antibody levels are higher and last longer. This has been proved beyond doubt. If you give the initial doses of the AP vaccine, that's the primary doses, and even if you give subsequently the whole cell vaccine, you will find that the antibody levels are not high enough and they don't last long enough. Therefore, this is a very important advantage of the whole cell vaccine, and there is enough literature to support this. Now, one of the very important things in which the whole cell vaccine definitely scores over the acellular vaccine is the duration of protection. Now, it is definitely longer in the whole cell vaccine, and the acellular vaccine, it is definitely less. Now, this has got a tremendous effect. This has been the reason, primary reason for the resurgence of pertussis in Western countries, especially in Europe and America. And this has been substantiated by immunological animal studies, to which we will come later. Now, regarding the herd effect, it has a documented herd effect as far as whole cell vaccine is concerned. There is no herd effect for acellular vaccine. Minor adverse reactions, like it occurs in one episode in 2 to 10 injections, like fever, even erythema, irritability, etc. But this is where the acellular vaccine scores. This is the only area where the acellular vaccine scores is equal to control. But remember this equal to control, therefore this definitely less than the whole cell vaccine. When it comes to serious adverse reaction, you would find that it is rare in both. It is equal in both. Therefore, you will find that scientific evidence is weighed against acellular vaccine and towards whole cell vaccine. It has a longer duration of action. It has a herd immunity, and its effectiveness is proved all over the world, and serious side effects are rare. Now, the acceptance globally of the whole cell vaccine has been poor. Now, this is because some children develop fever, convulsions, febrile convulsions, and the threshold for acceptance was much lower in the Western world. This has become worse because now the AP vaccines were promoted as painless injections and without side effect. Now when the Western world especially finds that the acellular vaccine is not that protective, its duration of protection is less than expected, and they are having epidemics even after giving boosters, they are unable to revert back to the whole cell vaccine. But at the same time in India, the IAP itself states that the acceptance has been good, both for whole cell vaccine and acellular vaccine. Please note that the Indian Academy of Pediatrics book itself states that the acceptance of the whole cell vaccine in the community has been good. And this has been my experience, and I'm sure most of the pediatricians in India would agree to it. This is important because later on they now state that you can give whole cell or acellular vaccine if there is parental anxiety. Why this flip-flop by the IAP? I am not able. Now, the longer protection of the whole cell vaccine is not just an observation, but is supported by animal studies and basic immunological workup also. The baboon model of pertussis suggests that faster waning of the protection with AP primary series and limited impact on infection and transmission. Therefore, what it suggests is that when you give AP vaccines in baboons, there is a limited impact on transmission also, and there is a faster waning of protection. Therefore, there is animal studies to substantiate the observation. It is suggested, the model also suggests, when both helper cell 1 and T helper cell 17 are stimulated, there is local sterilizing mucosal immunity that prevents the transmission, and produces a herd effect. And this helper cell 1 and T helper cell 17 has been shown to be stimulated by whole cell vaccine. When coming to acellular vaccine, it stimulates a higher T helper cell 2 cell, but lower helper cell 1 and helper cell 17 T cell response. And therefore they are less effective in clearing the pertussis organism and preventing transmission. Therefore it is not just an observation, it has been substantiated by animal studies and has a basic immunological explanation. Now the look at this article which has come about in the Pediatrics in 2019. This is very late. It's a Western journal. The resurgence of pertussis in the West, despite robust vaccination schedules and high vaccination rates, many countries, including the United States, have seen large pertussis outbreaks since the replacement of the whole-cell vaccine with SLR pertussis vaccine. In 2010 and 2014, between 2010 and 2014, California experienced two large pertussis outbreaks with 9,000 cases each. Most pertussis cases occurred among the age appropriately vaccinated children, suggesting that suboptimal vaccine effectiveness played a major role in pertussis epidemic. Remember, this has come in a 2019 journal on the pediatrics, which is the official journal of the American Academy of Pediatrics. And it can't get better than this. There seems to have no doubt that the lesser effectiveness of the SLR vaccine is definitely responsible for this. Now let's look at how the Indian journals look at the same reason. In 2013, in the position paper of the Indian Academy of Pediatrics, had no doubts. They made this statement: there are multiple factors responsible for the recent resurgence of pertussis in industrialized countries. They include enhanced awareness, increased public health reporting, introduction of sensitive tools like polymerase chain reaction for diagnosing infection, suboptimal efficacy of AP vaccine, and the potential antigenic drift in circulating pertussis vaccine. But the major concern is the lower efficacy of AP vaccine than WP vaccine. Now this is in 2013. They had no doubt about it. Now let's see what the IAP immunization guidebook of 2018 and 19 has to state. In page 141 to 42, the reasons for the resurgence of pertussis in a number of countries were found to be complex and varied by country. The shorter duration of protection and probable lower impact of AP vaccine on infection and transmission are likely to play critical roles. It goes on to state that many studies in industrialized countries documented faster waning with AP vaccine and showed the protection waned in 4 to 12 years. Remember, it is telling 4 to 12 years, as short as 4 years. Now, just 4 pages earlier, it had erroneously stated, it has contradicted the above statement by telling that the efficacy and duration of protection with diphtheria, tetanus and SLR vaccine against these diseases is similar to that afforded by the whole cell vaccine. Therefore, it says efficacy and duration of protection is similar. Therefore, it contradicts itself immediately or just 4 pages before the previous statement. Now I must state some contradictory statements coming from very important sources. The information sheet observed rate of vaccine reaction published by WHO in 2014. This must be a very authentic paper. States that for primary immunization, as for mild events, severe adverse events occurring after DTaP are similar in nature to those that occur after DTWP vaccine, but occur less frequently. They say even severe adverse reaction occurs less frequently. This is something which is contradictory to most of the other statement. For example, the IAP guidebook itself states that the serious side effect of AP vaccine are stated at par with WP vaccine. Therefore, this statement by the WHO contradicts the normal accepted fact that severe adverse reactions are equal in both SLR vaccine and whole cell vaccine. But all of us should know one thing for certain. there is no association between pertussis vaccination and encephalopathy with either vaccines, and also with the autism. If you are not sure about it, you are not a pediatrician. Therefore, the ultimate question is, what should we be preferring, the whole cell vaccine or the SLR vaccine? In the public health perspective, the Advisory Committee on Vaccines and Immunization, ACVIP, is sure to support the current immunization policy of employing only whole cell vaccine in the form of DTWP in UIP. But look at the reason behind it. It is sure of its proven efficacy, safety, adequate public acceptance, and absence of documentation of significant waning. This has been published both in the IAP guidebook as well as in the journal in which the advisory committee has published his recommendations. Now, if you take such a stand in public health perspective, you can't take a different stand as well as private health goes. Now let's start looking at what the IAP has to say regarding office immunization. It states that there is a scarcity of data on vaccine efficacies of both whole cell and AP vaccine in India and other developing countries. But at the same time, there is a continuous decline in reported pertussis cases in the last few decades that have demonstrated good effectiveness of the whole cell vaccine. It's a highly effective vaccine and the IAP has no doubts. Therefore, the Indian Academy of Pediatrics now recommends that in office practice, in private health sector, the primary infant series should be ideally be completed with 3 doses of whole cell vaccine. Therefore, there seems to be certainty on the issue. However, sadly, it is not so. However, contradictory statements come thick and fast. In the same IAP guidebook, in the third edition, in Annexure 1 in table in the page 473, which says IAP recommendation for routine use, it stated both whole cell vaccine and SLR vaccine or their combination can be used in primary series. Therefore, it directly contradicts itself in the same book in different pages. To complicate the matters further, in 2018-19, an update on the immunization schedule in children 0 to 8 published in the Indian Pediatrics stated that the primary series should be completed with 3 doses of whole cell vaccine or AP vaccine, irrespective of the number of components. It is rather surprising this has happened, and what has caused this change of heart is difficult to know. The whole world is telling that this should not be, the whole cell vaccine is better, and our public seem to accept it well. Why suddenly this change of heart by the IAP? The whole cell vaccine is definitely superior to AP vaccine in terms of immunogenicity and duration of protection, but more reactogenic. After agreeing that it's definitely superior, they say that's more reactogenic. But what is it? Is only minor side effect, which the parents in India have no problem. In view of the parental anxiety and concerns for its reactogenicity, AP vaccine can also be administered even in primary series. Therefore, the parental anxiety is the reason why they have now said AP vaccine can also be administered, and they justify by telling the primary aim is to increase the vaccination coverage by either of these vaccines. Therefore, here this change of heart of the IAP advisory committee is because suddenly they feel there is a lot of parental anxiety. Now I leave it to you in your own practice whether you meet this. There is aggressive promotion, no doubt, that SLR vaccine are painless injections. And the high cost of the SLR vaccine makes the whole cell vaccine an orphan medicine. Now I would like to refer to the webinar, which was the video which was published by the IAP on hexavalent vaccine recently. Many of you would have seen it. Now, it's vehemently stated there is nothing wrong in the SLA vaccine, and the recent resurgence of pertussis in the West has nothing to do with AP vaccine efficacy. This is a terrible statement as far as I'm concerned. Now, if you look at the New England Journal article in September 2012, it states very clearly, our findings highlight the need to develop new pertussis containing vaccine that will provide long-lasting immunity. There are multiple articles from the West itself which says that the duration of immunity is a problem in the wholesale vaccine as far as the SLA vaccine is concerned. Now the same webinar goes on to say one of the reasons why they promote SLA vaccine is none of the developed countries still using AP vaccine have reverted to wholesale vaccine. The reason for this has been stated by the Indian Academy of Pediatrics position paper well back in 2013, which states that the industrialized countries would not take the risk of reverting to wholesale vaccine, considering the low acceptance of these vaccines by the public in the past in Western countries. Acceptance of wholesale vaccine has not been a problem in developing countries like India. Therefore, this argument falls flat. It's not only the IAP, but even the WHO does a flip-flop. His position in 2015 paper, in 2015 on pertussis states that protection against severe pertussis in infants and early childhood can be obtained with primary series of either wholesale or AP vaccine. But immediately it states available evidence indicates that there is more rapid waning of immunity and possibly a reduced impact on transmission with SLA vaccine related to wholesale vaccine. If there is such a difference, how can you suggest either of them, when especially the beta vaccine is less costly? Now you can read in between lines when it states further that national programs currently using AP vaccine may continue, but should consider the need for additional booster doses, and national programs currently administering wholesale vaccine should continue with the wholesale vaccine. Therefore, his inclination is very clear, and the reason why it doesn't want to say only use wholesale vaccine is probably clear to any reader. WHO further states a switch from the wholesale to AP vaccine for primary infant immunization should only be considered if additional periodic dose boosters or maternal immunization can be assured. What it means is that if you are giving SLA vaccine in the primary series, you must make sure that he receives the vaccine not only at 5 years, periodic boosters. And now, what is this periodic boosters? Some people say it's minimum 5 years. Some people say after the fifth 5-year dose, you may have to give again at 8 years. Now, this faith in the periodic boosters has been questioned in the article in New England Journal, which has written about the waning protection after the 5th dose of SLA vaccine in children. They have studied this in depth and come to the conclusion. Evaluation of data from a large pertussis outbreak in California showed that protection from the disease after 5th dose of DTaP among children who received only DTaP vaccine was relatively short-lived and waned substantially each year. They go on to state it lasts only 2 to 3 years. Therefore, this faith with the WHO puts on the periodic boosters is not backed by science. So what are the carry-home messages? Wholesale vaccine has more efficacy and definitely longer duration of protection than SLA vaccines. SLA vaccine have the same mild and serious reaction, but with less frequency of mild reaction than wholesale vaccine. There are reliable reports that the serious reactions to SLA vaccine are in par with the wholesale vaccines. And there is no association between pertussis vaccination and encephalopathy with either vaccine. This is true with autism also. In my practice, I'm very clear. I prefer the whole cell vaccine for both the primary and secondary doses. I counsel them that this less costly vaccine is equally effective as the SLR vaccine and definitely has a more duration of protection. Now to the parents, few parents who complain, who ask for painless injection. I counsel them telling that if there are no pains, there are no gains in life. But if they insist on taking the painless injection, as they put it, I would go by the parents' preference. Now, some of you might turn around and ask, which hexavalent vaccine can we give which contains whole cell pertussis component? That is another matter, and I will discuss that in another of my videos. Well, I blog on this site, Pediatric Theory Practice, wordprocess.com, and I normally pick up one topic at a time. Like today, I have discussed about whole cell vaccine versus SLR vaccine, and this is a part of a clinical decision aid for practicing pediatricians who are too busy to read the latest journals. Now, this is an evidence-based, up-to-date pediatric practice aid, and I dissect only one clinically relevant bedside pediatric issue at a time. And I am Dr. A. Padmanabhan, a practicing pediatrician. Goodbye till we see next time.